Hi, I'm Penny, and in this video I'm going to give a quick update on my chemo port surgery. The surgery for me happened quite quickly after my treatment plan was put in place. It happened about 10 days before I was due to start chemotherapy. I was quite surprised actually. The surgery happened before I was in touch with the chemo nurses, but it was fine. On the day, I went to my local hospital and had the procedure. It took about 45 minutes. I elected not to have a sedative. I was given a choice. So the procedure was done under local anaesthetic, and I was given a choice as to whether or not to have sedation. And I chose not to have sedation. Now, with the benefit of hindsight, I wish I had chosen to have sedation, and if I ever had to do it again, I would, and I would recommend for others that you do consider it, because I thought that with general anaesthetic, with local anaesthetic, I would be fine, because I had recently had a biopsy under local anaesthetic and the procedure had gone fine and I wasn't too bothered by it. But the chemo port surgery is a bit more invasive than a biopsy, because they actually have to make an incision in your skin and create space and insert the port. And even though psychologically I wasn't anxious about it, physically my body was a little bit traumatized by the experience. So by the end of the procedure, I was a little bit shaky and I felt as though my body had experienced a little bit of trauma, and perhaps might have felt a bit more relaxed if I'd opted to take the sedatives, which I didn't do on the day. Anyway, the procedure itself was relatively straightforward. I didn't feel any pain. There was a lot of local anaesthetic injected into the area, and the surgeon was very attentive to ask whether I could feel anything. The only thing I really felt was a bit of pressure where they were pressing down and trying to create space and insert the device. And then I felt some slightly odd sensations in my veins when they were using a guide wire to insert the tubes and stuff. So because I think normally these ports are inserted on the right hand side close to the main veins that the tubes need to go into, but because my cancer is on the right hand side, in my case it had to go in on the left, and they had to go through my jugular vein and go across to the main vein. So I have the port, which I'll show you in just a minute, the port here on the left side, and then a tube that runs sort of through multiple veins to get over to the main vein on the right hand side. So as I say, the procedure itself was fine. I will just show you, it's been probably nearly a month now since I had it, so I will just show you so you can see there's a small mark here where they made the incision in the vein to guide the tubes through, and then I've got, this is where the port is, and then I've got obviously a small wound here where they made the incision and then closed it afterwards with some dissolvable stitches and surgical glue. After the procedure, I had a lot of bruising around this area. It was very sore and very tender, but I had expected that and I didn't really mind it because I felt it was a normal part of the procedure. I think a lot of people experience that. Obviously, they have to press down on your chest and create space for the thing and put it in. So it's all very sore and tender, and you're not allowed to lift or move too much. So I was expecting that. The thing I experienced that I wasn't expecting, which I will just share with you in case it's useful to anyone else, is I was very much aware of the tube. Like, I could feel the tube in my vein when I breathed deeply, when I tried to lie back, when I coughed or laughed, or anything that involved any kind of movement of my chest. So for the first week after the procedure, I could not sleep very well at all. I couldn't lie on my back, I couldn't lie on my side. I had to do some strange pillow configurations, so I was sort of trying to sleep half upright, with support behind my back. And really only in that position. I couldn't be on my side or anything. So it was very uncomfortable for me during the first week. And during that time, I went in to see the chemo team because they were prepping to do my chemotherapy the following week. And they very kindly arranged for me to have some imaging done to make sure that the device was in the right place and it hadn't, moved or slipped or was pressing against something it shouldn't be. But the imaging showed that the device was where the surgeon had intended it to be. And they told me that I had just a sort of hyper-awareness, hypersensitivity that made me more aware of feeling the tube from the port a bit more than perhaps other people do. I don't know. I did try to do a little bit of research. It didn't seem to me that this was a particularly common thing that other people had experienced, but for me at least, I just was very much aware of it. I had a lot of tightness and discomfort as my body was adjusting to getting used to this thing being there. So in the end, it took about a week or so to settle down. And then from the second week onwards, it began to calm down a bit. Gradually, it began to calm down a bit. And now I am quite comfortable with it. I don't really experience any discomfort. I'm okay lying on my back now. I can lie on my side as well, and I'm getting a bit more sleep, so I'm grateful for that. I'm also quite grateful that I had that sort of period of about 10 days before the chemotherapy actually started to allow the port to settle. I'm not sure how comfortable I would have been trying to have my chemotherapy during that week when it was all very uncomfortable for me and I couldn't sleep, and I was sort of quite worried about what was going on. Anyway, so it's settled down now and it's all right. I'm just sharing the experience in case it's relevant for any of you. The other thing I would say is about a month or so after my port surgery, just in this little tiny wound here at my neck, where they made the incision for the guide wire to put the tubing through, this wound became very red and my oncologist thought it was infected. So I had to take a course of antibiotics for 7 days because obviously when you're on chemotherapy and immunotherapy, the number one risk that the doctors worry about is infection, and I could not afford to have an infection or try to fight an infection without the help of antibiotics. So I ended up on antibiotics for a week, which I could have done without, but anyway, it has helped a lot. The wound has now sort of gone down and has calmed down a lot. And I've finished the course of antibiotics now, so just mentioning that in case it's relevant. Anyway, that's it, my port surgery in a nutshell. The procedure went well. I'd recommend sedation. It was a bit sore afterwards here, which I think is normal. It takes about 2 to 3 weeks to settle down. And then if you're a bit unusual like me, you might have some sensation around being able to feel the catheter tube from the port. But even if you do, mine in a week or so also settled down. So hopefully that's of use. Anyway, that's it for today. See you in the next one.